Is Robert Barber, who is a founding Orion Planning Group partner, having retired after 25 years of public service. He is currently the president of the Mississippi chapter of the American Planning Association and former chairman of APA's chapter, President's Council, and the National Board of Advisors. Let's welcome Bob to the podium, please.
Thank you, Marlo. I have to do this because I'm sort of challenged in this way. Governor, thank you very much for having us. Thank you for your work, and thank everyone for hanging in to the bitter end. I, with my colleague Chris Watson, appreciate the inclusion of members of the American Institute of Certified Planners in conducting this work. We're all ethically bound to the same kind of quality and process. And as chairman of the College of Fellows of the American Institute of Certified Planners, which I am currently, I know of no place across the country who's provided the kind of support that you have. So we appreciate that. I'm also surprised to see that they gave me 15 minutes on the clock back here. Is that? It's not true. I will move through quickly. We were responsible. We tried to coordinate our remarks so we could each sort of not trip over ourselves making the same statement. So let me just mention quickly, you've heard market data, you've heard something about the planning process, which can be incredibly boring in the abstract. We recognize that. Let me throw out a few ways that we brought to our planning process that we think is very, very important to get buy-in from the community, to get a plan that will be implemented and can be supported. So in our investigation of best practices, which is a part of your planning process, we pulled together best practices among the headings across the top line here. That a good plan will have mechanisms for organization. There must be somebody to grasp this and move it forward, whether it's an economic development group or a city or a combination thereof. In Madison County, we put together an ad hoc committee, and Jordan Hillman will chair it to push that forward. There's an element of design which is so absolutely vital and critical. We can crunch the numbers, we can crunch the jobs. I think the economic developers will tell us that if we do not build quality of place around these hospitals and medical facilities, that they may last for a time, but they will wither away. So quality of place is vital, and that's the design element that we mentioned then. There's the marketing element as is included there. There's also an element of infrastructure. There's a regulatory element, which governments are real good at regulating, but that element is included, and then there's the incentives, which we have been discussing. Now, how can we get people to buy in that in the community? We are very partial to a charrette-like process. And if you've been involved in a charrette, you know that we can gather the stakeholders together, not have meeting after meeting, an hour here, an hour there, a little bit here, a little bit there, look at pages of reports, but actually pull together the players and the stakeholders in the same room at the same time for a compressed period of time, pull the maps out, get the hospital CEO, the landowner, the adjoining residents, and plan that place. When everybody can join in this process of a charrette, I hope you've heard that term, this focused, intensive planning effort, we can generate a vision for place, as is indicated here in this vision statement. We want to create a space in Madison County that is high quality. I tried to highlight some of the key words. High quality, healthcare industry community, vibrant with mixed-use areas, new residents and businesses, enjoyable public spaces, etc., etc. A vision statement, a mission statement, if you will, that then guides the design and the specific elements of the place. That's what these folks in the room here on the slide did. We had, 15, 20 people involved. Had we not worked under such a compressed time frame, we would have even made it more inclusive and brought more folks in and have a real viable healthcare district for Madison County. Ultimately, we ended up with a design of space allocations based on number crunching and so forth, but with the vision of the space, and it is not architecturally rendered here, we could render it, streetscapes, buildings, how future buildings would be placed at the street so that we're truly building a community. But we did allocate space according to market reality. It's great to have the vision. The vision must be tempered by market reality. And so that is our space allocation. And then we end up with a plan that is color-coded for various kinds of development in various places. Now, in Madison County, what we end up with is a hospital, and my laser pointer is on your right screen here. The hospital is in this area here, and then the University of Mississippi State is here. But this entire area of 1,000 or so acres is inclusive of retail development, of housing, so that we do have allocated neighborhoods and housing. There's a huge public component here of green space and parks. There's a assisted living or a nursing facility, retirement facility involved. It is intended to meet the vision statement that a total community. And then the streetscapes would involve a high character of design so that we can brand that place. You're in the Canton-Madison County Healthcare District, or whatever the good name is going to be. And we can put the banners up, and we can create the focal points and entryways around that vision. And I tell you, if I was trying to sell something, if I wanted to market a place, that's what I would want to market. Something that I could show, sell, get people excited about, and that would indeed ultimately be built in the community. So that is the sense of place that we want to bring to the planning process. That's the importance of a vision statement, but most importantly, an inclusive process where the stakeholders are gathered and we can organize around that place and build it for the benefit of the community. So I'm zeroed out. I want you to know I hit it exactly on zero, okay?